Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to deal with a new topic, that is patient teaching. So here, what do you think patient teaching is? Here, whenever you are in the hospital setting, whenever you provide any information or whenever you impart any knowledge to the client or to the caregivers about the various methods in which they can adopt in order to improve their health or to alter their health behavior, then this process is known as patient teaching. This patient teaching is very important because why? It is through this that the client will be having an idea of what is the disease condition he is suffering from and what are the various things he can adopt to in order to promote his health. Now let's move on to the definition of patient teaching. This patient teaching is defined as the process of informing the patient about their health matter, about their disease condition, about what are the treatments they need to follow. And it is also a process whereby you will be getting to secure the informed consent, the cooperation, as well as a high patient teaching level of patient compliance. So as a nurse, it is very important that you must be able to perform this patient teaching effectively, because it is only through this that you will be able to communicate with the patient to impart the knowledge or any information which is required in order to help them attain a good health. Nurse can perform this patient teaching anywhere and everywhere. However, it will be more effective and beneficial if you perform it after the assessment has been done. Why? Because during the assessment, you will be getting a brief information of what is the educational background, what are their knowledge, what are their perception. So after you've got a clear idea of that particular client, if you plan this patient teaching, then it will be more effective, because here you will be knowing what you need to say, what you need to tell, and what you need to inform them, and what are the various things you can help them to improve their knowledge so that they will be able to promote their own health. So what is the purpose of this patient teaching? Here, the main purpose of this patient teaching is to help the person promote, maintain, as well as to protect their health. So here, if you are educating the patient or the client about the various factors they need to, adopt to, or the various methods which they need to follow in order to attain their health, then this can also help them to promote their own health. It also helps to identify the relevant healthcare needs of the client. Even when you are performing this patient teaching, you can also provide emotional as well as cognitive support to the client. This patient teaching also helps the nurse to be knowledgeable. Why? Because as a nurse, you will be encountering many patients with different conditions. So here, when you encounter these type of patient, you will also upgrade your knowledge, because you will be the one who will be educating them about the various things they need to follow, the various methods they need to adopt to, or the various things which they need to prevent in order to promote their health. It also helps the nurse to raise their confidence level whenever they are teaching. So here, if the nurse is already knowledgeable, if the nurse knows what is to be imparted to the client, then this will also help her to boost up her confidence level. So these are the various purpose of patient teaching. Now let us move on to the importance. So why is this patient teaching important? The first one is that the patient has the right to be informed. So here, through this patient teaching, you will be able to inform the client about her disease condition, about her treatment. As we all know that, a client has a right to be informed about each and everything which is related to him or her. So it is through this patient teaching that you will be able to provide all the necessary information which may be required. This patient teaching also involves a dynamic interaction between the client and the nurse. So since there is an interaction between the nurse and the client, so you must make sure that during this interaction, you must be able to communicate all the information, the emotions, the perception, the attitude, as well as the methods which they can adopt to in order to promote their health and in order to help them gain an idea of their own disease condition. It also ensures the patient's safe transition from one level of care to the other, and it also helps in making appropriate plans for the follow-up treatment which they may require in case they leave the hospital setting. As we know that client also plays a major role in decision making. So here through this patient teaching, you will be able to educate the client about why this particular treatment is required for her. And after you have educated her about this, then the client will be able to get an idea of why we are doing this, and she or he will also cooperate with this only if they have a good idea about it, right? If they don't have any idea why is this procedure being done to them, and if in case if it's a procedure which can also hurt them, then they can also feel that it is not beneficial or they don't want to do. But only if you educate them that why this is important and what are the benefits you may gain from them, then they will be able to cooperate with you and as well as help to perform your procedures effectively. It also enables the patient to assume better responsibility of their own health. So here, through this patient teaching, the client will be able to understand that if they are doing these, then this can affect them. So if they have a knowledge that, they should prevent themselves from doing these particular things so that they can regain their health, then they will not be doing it. And also, it also improves the patient's ability to manage any acute or chronic condition. It also provides an opportunity for the client to choose a healthier lifestyle rather than just depending on the medications. So here in this patient teaching, you will not only be educating the client about their disease condition or about the treatment, but you can also, educate them about the alternative methods which they can take in order to improve their lifestyle. So through this patient education, you can also provide an opportunity for them, to choose a healthier lifestyle rather than just depending on the treatment or the medications. It also promotes the patient-centered care. So here, if this patient-centered care is being promoted, then the patient will also actively involve themselves in the planning of their treatment. This patient teaching also ensures the continuity of care and reduce any complication which can occur due to their illness or their disease condition. It also maximizes the individual independence with home exercise programs and activities in order to promote their independence after they have left the hospital setting. So here, before the patient or before the client leave the hospital setting, it is very important that you teach them some home exercise program or activities which they can perform so that they will not be depending on the family members so much. So now, since we know what patient teaching is, what is the purpose of this patient teaching as well as the importance, now we will move on to the process of patient teaching. Here it involves the following steps. The first one is to assess the learning needs of the patient. The second is to develop the learning objective. So after you have assessed and after you have developed the objective, the next thing, plan and implement this patient teaching. After it has been planned and implemented, you should also evaluate the outcome. And after you have evaluated, the last step is to document the patient teaching as well as learning. So now let us look at each step in detail. So assessing the learning needs, here from the name itself, you can understand that what you need to do here is you have to assess what the client needs to know, what are the information he needs to get. So here, as soon as the client comes to the hospital setting, the first thing is you must introduce yourself as well as collect all the history of the client. So while you are collecting here, you will be getting an information or you'll be getting an idea whether the client has adequate knowledge about his or her disease condition or not. And if not, or if you have found that there are few things which the client knows, but there are also a few things which he or she doesn't know, what you can do is you can jot down whatever they don't know so that you will be able to provide them all these information when you are doing this patient teaching. Then the next one is to develop the learning objectives. So here, after you have assessed the learning needs of the client, the next thing you should do is you should develop a learning objective as what are the goals you need to achieve at the end of this patient teaching. Here, whatever objectives you have set, you must make sure that it must be achievable as well as accessible. Here, you must also make sure that you should mention clearly what is expected from the client, be it their attitude, their perception, their lifestyle, their behavior, or even their understanding. So here, after you have accessed the learning needs and after you have developed the learning objective, the next is to plan and implement this patient teaching. Here, as a nurse, you should always be ready to perform this patient teaching. However, it will be more fruitful if it is a well-planned and an organized one. Here, the planning of this particular patient teaching depends on the need of the patient. That's why, right, we do the assessment first. So after, you have got an idea what are the various things the particular client needs to know, then only you can implement this patient teaching. You must also keep into consideration the environment condition before you deliver this patient teaching. In case now, if the client is not comfortable or if he is suffering from pain, then it will not be effective no matter how much you try to deliver this patient teaching. It is very favorable, especially if you are able to take an appointment for this. So here, if you can take an appointment whereby you can tell the client that I will be coming at this particular time in order to teach you about your own disease condition, and it will take me around 20 minutes or 30 minutes. Then if you have already booked an appointment, then this patient teaching can be very beneficial. In order to make it more lively and interesting, you can also use AV-aids like charts, posters, flannel cards, etc. And also, before you introduce the topic, you should make sure that you tell the client and the family members that they can stop you at any time in order to clear their doubts. And the last one here is that before you end this patient teaching, you must confirm whether the client and the family members have fully understood this teaching or not, and you must also see that you must achieve whatever objectives which you have set for this patient teaching. So then the next thing you can do is you can evaluate this teaching. You can evaluate what was the outcome of this teaching, whether it was beneficial or not, whether the client had got the, important message or whatever you was trying to convey through that patient teaching, whether the objectives has been met or not. So here it is also very important that you must take the feedback from the client or from the family members, whoever was present during the patient teaching. Then the last one is documenting. So after you have assessed, after you have developed the objectives, after you have planned, you've implemented, and after you have evaluated, it is very important that you must document the patient teaching. Where was it done? At what time was it done? And to whom was it done? Not only the client name, but if the family members were also present, then you can also jot down their name so that it will be easy for you and also for the other healthcare members, so that they will not be repeating the same thing again. And it is also safe to document this, because sometimes you may encounter a patient where after we have done the treatment, they may say that, no, I didn't wanted this, or no, I didn't knew it would be like this. So through this patient teaching, after you have educated them why is it important and why do they need it, after they have said that, okay, they have got an idea of what it is about, later on, if they try to deny, then you will also be able to serve it as a proof that this was already informed to them. So now we are going to learn about what are the various roles of a nurse in patient teaching. Here, the first and the foremost important role of a nurse is that she must assess the learning needs of the client. Only after she has assessed what are the things that the client need to be informed about, what are the things which the client don't have any knowledge about, then only she can then plan and also implement this in order to help them, gain a knowledge about their own disease condition and about the various things they can adopt to in order to maintain their health. Through this patient education, you can also motivate the client as well as encourage them to learn about the various things they need to do in order to promote their health. As a nurse, you must also make sure that you involve the patient when you are performing this patient education. You must also make sure that the topic of this patient teaching should match with the needs of the client. Only if it matches, only if it is related to the disease condition of the client, then only the client will have the interest to listen to it. We should also organize the content of the teaching accordingly. So for example, if you are teaching the client about their own disease condition, first you must start what does the disease condition means, what are the various causes of this particular disease condition. Then only you can go on to the symptoms, to the diagnostic evaluation, as well as to the treatment, right? So here, suppose now if you go to the client in order to educate the client, and instead of starting accordingly, if you first talk about the treatment, then you talk about the symptoms, then you talk about management, then you talk about the definition of that particular disease condition, then this will not prove to be an effective one. You should also make sure that you provide a conductive environment when you are doing this patient teaching. You should also observe the client emotional as well as the psychological need. And the last one is that being a nurse who is delivering this patient teaching, it is very important that you must be knowledgeable about that particular topic so that you will be able to deliver it in full of confidence. So here, only after you are fully thorough with whatever you are going to impart or whatever information you are going to communicate, then only you will be able to be very confident. So here, being confident with whatever you speak is very important, because it depends on this whether the client will be able to trust you in the upcoming treatment as well as the procedures which you are going to perform for the client. So these are the various roles of a nurse for patient teaching. Now moving on to the last one, that is the guidelines for an effective patient teaching. The first one is development and maintenance of a good rapport. Here, you must always maintain a good rapport with your client or with the family members, because if you are able to maintain a good rapport, then the communication can be an effective one. You should also get an idea about the knowledge of the client from their previous learning. You should also, choose a particular time for delivering this patient teaching. And as a nurse, it is very important that you have a good communication skills. You must also provide all this information through the local language, or, we can say a language which they will be able to understand. We can also make use of different AV-aids such as the chart, the posters, the flannel cards, or leaflets and pamphlets. We can also use the demonstration method, especially when it is related to any procedures which they have to perform, which the client or the family members will have to perform when they leave the hospital setting, in order to maintain the continuity of care. And whenever we are doing this patient teaching, we must make sure that there is an active involvement of the client. We must make sure that we are able to grasp all the attention and the interest of the client. So these are the various guidelines for an effective patient teaching. So now here we have come to the end of this topic. So in today's session, we have discussed about patient teaching, the purpose, the importance, the process of patient teaching, as well as the role of a nurse and the guidelines for an effective patient teaching. So I hope you guys have got a clear understanding of this topic. Thank you.